objection, so ordered.
Thank you, Mr. President. Mr. President, we need serious substantive health care reform. The reasons for reform are well known, and they have led to overwhelming consensus in Congress that something needs to be done to make health care more affordable and more accessible. The desire for action extends well beyond the walls of this great building. The American people also want us to act, but this desire for action shouldn't give way to legislative haste. Americans do not want us to rush at the expense of getting it right. They have questions and they deserve answers. There are two very basic and important questions with regard to health care reform. Number one, how much is it going to cost? And number two, how will we pay for it? So first, let's look at the question of cost. The American public is alarmed about the massive debt we are accumulating. They realize that in the past year, on top of the almost $1 trillion stimulus bill, the federal government has also purchased banks, an insurance company, and an auto company, all using borrowed money that we as taxpayers will need to pay back. All of this massive borrowing and spending was done quickly and with little debate. This was done, the public was told, in order to save the economy. Well, how has that turned out? At the beginning of the year, the Obama administration told the American people that massive stimulus spending, if done quickly, would create 3 to 4 million jobs and would keep the country's unemployment rate at 8%. Today, sadly, unemployment is at 9.5%, the highest level since 1983. The jobs that were promised have not materialized. In fact, 467,000 additional jobs were lost last month alone. The administration now says they misread the economy. Our government rushed to borrow and spend $1 trillion, but now we're basically being told they were wrong. Vice President Biden said as much only a few days ago. Unfortunately, the American taxpayers are not going to get a do-over on this spending. They're still on the hook for the almost $1 trillion we borrowed plus interest. Now there's talk of yet another expensive stimulus package to make up for the one that didn't work. So considering this, it's no surprise that the American public is skeptical about the rush to spend yet another $1 trillion or more to create a Washington-run health care scheme. We have a number of proposals in Congress that attempt to fix health care. There are workable reform proposals that go at the problem in a way that doesn't incur such prohibitive costs for taxpayers. Unfortunately, however, our Democratic colleagues have plans accompanied by astronomical costs to taxpayers. The Finance Committee is struggling to keep its bill at $1 trillion over 10 years. We're told that just a portion of the Health, Education, Labor, and Pensions Help Committee bill will cost over $1 trillion. That's just a portion of their bill, and some have estimated that the total cost for that bill will be over $3 trillion. These are not scare tactics, Mr. President. These are Congressional Budget Office estimates. On the other side of the Capitol, the House Democrats' bill is expected to cost closer to $2 trillion. And over and above these federal costs, there are frightening costs to the states. If the Help Committee proposal to expand Medicaid is enacted, we can expect a wholesale collapse of state budgets. And of course, we're already seeing the collapse of some state budgets. They're already struggling under the unsustainable costs of the current program. These spending figures are startling by themselves and even more troubling taken on top of the massive amount of debt we've already acquired. Even more troubling is the expectation that costs of the Democrat proposals will continue to rise year after year, well beyond the 10-year budget window used to figure the price tag of these proposals. The Congressional Budget Office estimated that the annual cost of the insurance subsidy program contained in an earlier version of the HELP bill would rise 6.7% per year until it's fully phased in. This potential spending explosion shouldn't come as a surprise. Medicare and Medicaid two programs that we need to strengthen and help and sustain, are both already on unsustainable paths with enormous unfunded liabilities. This daunting amount of spending has taxpayers worried, and they are beginning to speak up. One of my Democratic colleagues acknowledged this recently, saying, quote, "The big challenge," and I actually heard this at home during the recess, "is the sticker shock," unquote. Other supporters of the president are also warning him and his Democratic colleagues in Congress to slow down and be more careful with taxpayer dollars. On Sunday, former Secretary of State Colin Powell, an Obama supporter last year, warned the president about the ongoing spending spree, saying you can have so many things on the table, you can't absorb it all. And to quote Secretary Powell, "and we can't pay for it all," unquote. In addition to the massive cost associated with these proposals, no one can yet tell us where the money will come from to pay for them. All the proposals we have seen are creative in the way they spend tax dollars, but very short on specifics on how to fund them. Our colleagues on the other side of the aisle have vaguely outlined some ways they may pay for their plan, including a series of cuts to Medicare and Medicaid. I repeat, cuts to Medicare and Medicaid, along with new taxes. But they've not been as forthcoming and specific as they need to be with the American taxpayers. There's a reason why more details have yet to be released. Since we don't have the money to pay for a government takeover of health care, there will need to be massive tax increases or more borrowing or a combination of the two. In fact, one leading Senate Democrat was quoted in Wednesday's Wall Street Journal as saying they were, quote, broadening the search for revenue to pay for this massive plan. What that really means, of course, they're intensifying their search for ways to raise taxes on the American people, whether it be taxes on small business, which we've been hearing about lately, or on health insurance plans, or surtaxes on soft drinks, or anything else they can think of. Massive tax increases for the American people for plans which admittedly will only cover 1/3 of the uninsured persons in the United States of America. All the while, this is being done quickly and without time needed to provide the scrutiny the American public expects and deserves. All Americans, Republicans, Democrats, and independents want health care reform, but they don't want a government-run health care plan. They don't want to pay for it with Medicare and Medicaid cuts, and they don't want to drive up the debt. Getting it right is more important than getting it done quickly. Let's learn from the mistakes that were made in hastily passing the stimulus bill. Massive new amounts of borrowing, spending, and taxes are not the way to successful health care reform. Mr. President, I suggest the absence of a quorum.
The clerk will call the roll.
Mr. Akaka.